Oh, yeah. Well, that was when Jim decided to be Mr. Mom. Hello, and welcome to another edition of Health Matters. I'm your host, Dr. Bruce Karlin, and it's my pleasure today to have my old friend Dale Magee, uh, practicing obstetrician gynecologist for 35 years, just recently retired, and really critical to the Worcester District Medical Society as former president, current treasurer, historian, curator, and a host of other things, and also a former president of the Mass Medical Society as well. And our topic today is one near and dear to you, which is the history of the Worcester District Medical Society. Welcome.
Well, thank you for having me here. This is a very interesting project. I'm interested in the history of medicine anyway, but the opportunity to research out the history of the Worcester District Medical Society in preparation for our 225th anniversary, it being founded in 1794, was just terrific. And I learned a lot. We're preparing a video which will be available to the public.
We're going to have ourselves quite a gala
Right.
Celebration on September 27th.
Right.
And we're all looking forward to it. And one of the keys to it is your video. That's going to be one of the highlights.
Very interesting to develop it, getting the pictures, researching out the facts and everything. Learn things I hadn't realized about central Massachusetts. Didn't really recognize the character of this area of the state, and the fact that as people moved out of Boston and towards central and western Massachusetts, it wasn't just that Boston was running out of space. It was that this generation of people wanted to strike out on their own. They wanted to be their own bosses, and distance gave them some insulation from the authorities in Boston. So that sort of set the stage for the way it developed after the Revolution and after the United States became established.
One of the interesting, perhaps apocryphal, but nonetheless interesting fact is that when the shot heard round the world was fired, it was in protection of ammunition stored in Worcester.
Right.
So we've got some history there.
Oh, you've got a lot.
Yeah.
But interesting was the fact that this area, central and western Massachusetts, prior to the establishment of Boston as the capital of the state, lobbied over and over again to not make Boston the capital of the state. They felt that too much power would flow to Boston and that the central Massachusetts would lose power as a result of that. And so this sets up the kind of situation where there was this little antagonism that those people in Boston are pulling power away once the revolution is over, and that sets up the stage for the development of the Worcester Medical Society. Doctors in Boston had established, right the same year that the Revolutionary War ended, they established the Massachusetts Medical Society. And they didn't call it the Boston Medical Society. They called it the Massachusetts Medical Society. They were chartered by the state and given the authority to license physicians, to approve them for practice. There was no other licensing authority. And they limited themselves in their constitution of the Massachusetts Medical Society to 70 members, only one of which was west of Framingham. So the doctors in Worcester felt
Is that how they established where 128 ran?
Right. That's probably it. So-and-so's house. But so doctors in Worcester felt excluded, and they still felt the need to have an organization in which they could get together, they could learn more, they could better themselves, they could certify physicians so that there was some sense of professionalism. And so it was in that context that they formed in December of 1794 the Worcester Medical Society. However, they needed, in order to license physicians, they needed a charter from the state. And the Massachusetts Medical Society was having none of that. So a full decade of lobbying back and forth with the legislature occurred until 10 years later it was settled by Worcester becoming a district of the Massachusetts Medical Society in 1804 and having authority over all physicians west of Framingham. And that way they opened up the membership. They had the authority to certify physicians, and they were able to continue and grow.
What I find fascinating in this story is that the medical societies were responsible for the certification of the physicians back then.
Right.
Now that's all changed.
Was true until 1894, actually. And so the Board of Registration in Medicine in Massachusetts wasn't established until the 1890s. But up until then, we take for granted today that physicians are highly educated, that they're certified, that they've gone through a process to make sure that they were good and safe for the public. In those days, that was not the case. Anybody who wanted to call themselves a doctor could. And even among those who practiced more traditional medicine, the vast majority didn't attend medical school. They would do a apprenticeship for 3 or 4 years with a physician who, at the end of that period of time, may give them a set of tools, a letter of endorsement, and they would go out and begin to practice. The medical schools didn't have students seeing patients. They would just teach theory. And theory in the 1700s and early 1800s was not scientific theory. It was tradition. It was what people had been doing for hundreds of years.
What your grandma told you.
Well, worse than that. Because there was bleeding, there was purging, there was all kinds of blistering. Things that were intended to restore balance was the operative theme, the big theory that held things together. So there wasn't a lot to teach in these medical schools. They did expose people to patients. So even when you went to medical school, it wasn't necessarily a step up from doing an apprenticeship. But you can see that in that context, particularly in the age of the Enlightenment, where this waking up was occurring with regard to science and all that it could achieve, that physicians would see a need to find other ways to educate each other and themselves, and gathering together so that they can present cases to each other, discuss them, and discuss the latest theories or literature, develop a library because books were pricey and doctors weren't making much money. Most of them probably were doing something else to earn a living. So that was the context under which our society was born.
As you're discussing this, you say, well, geez, it really was primitive in what we were doing. But some years ago, I visited the Civil War Medical Museum in Frederick, Maryland.
Right.
And you say, well, how primitive it was. But they had amazing prostheses, and they had amazing ways to deal with broken bones that you said, geez, how clever that is. And they made do with what they had. So the idea of certifying these different practices and sharing them was really part of our sort of heritage and in our district medical societies.
Well, you bring up an interesting point, and that is that something that was true then and is even true today is that war serves as a means of just accelerating medical innovation. The needs are so acute, the results are right in front of you, and the demands are such that innovation has occurred in the development of especially trauma care during the wars, which has then benefited the population afterwards because of the things that were learned. So those prostheses, the surgical techniques, things such as that, there was progress made during the Civil War and even during the conflicts and wars that we experience today.
So coming forward, what we're doing is we're going to celebrate this in our gala. First off, I'm really excited about the gala. It's just going to be a fun night. It's going to be a celebration of what the Worcester District Medical Society is and does.
Right.
And I mean, even the stuff that we're sharing with the audience now is part of our mission at the Worcester District Medical Society is to tell you about, what's happening in medicine. But the historical portions, most of us are just, we don't know about it. Why bother?
Yeah.
I find the Revolutionary War stories really fascinating. You were talking about sort of the arc of history, and how the Worcester District Medical Society started out with a fellow. What was his name?
Ebenezer Morse.
Well, we've heard of a Morse.
We've heard of Leonard Morse, right? They're not related. But Ebenezer Morse was actually a resident of Shrewsbury, highly educated, and trained in law, ministry, and medicine. And essentially started off as a minister in Shrewsbury, in northern Shrewsbury, a district that later became West Boylston. He was the minister from the 1740s into the 1770s. What happened was when the bug was in the air to have a revolution and separate from England, he did not agree. He was a royalist. He wanted us to stick with the status quo. And so his flock in West Boylston evicted him. He was no longer able to function as a minister. And so his fallback career was medicine. And but having gone through that kind of conflict, having someone who can articulate their point of view and someone who is skeptical of authority coming from Boston, it probably doesn't come as a surprise that he was fast to the meeting that was held in Worcester and was responsible for convening the first meeting.
So you're bringing up another point. So the Worcester District Medical Society was actually sort of a counterbalance to the Mass Medical Society.
Correct.
And now we're together. We're still a part of.
We're a district. We became a district in 1804. But in those days, it would take a day to get to Boston. It was a big deal. And if you needed...
We're getting back there, by the way. I don't know if you've been on the Mass Pike recently, but it could take you a day to get into Boston.
Well, in any event, to say, even if they weren't excluding people, and they were excluding people, but even if they weren't, the fact that, some of the members walked to the library that was set up by the Massachusetts Medical Society, and others would have to travel by carriage for a day to get there, it really wasn't a situation that was going to work. The district system was more realistic, and in fact, these days there are 20 districts to the Massachusetts Medical Society, bringing a local flavor to the membership in the society and allowing the members to get to know each other better and to accomplish more locally.
And I would say that the Worcester District Medical Society shines at the Mass
Hands
Medical
down.
Society.
Yes.
We are, but I think it's part of our revolutionary heritage or our contrariness that, but it stirs stuff up. We promote a lot of the new ideas come out of the Worcester District. And we're still there.
Well, there's two things here. I think one is that DNA that is here in Worcester, which basically casts a skeptical eye towards a lot of things and tries to find ways to do things better. I think that's something that continuously comes from Worcester. Even when we look at big decision points at the Massachusetts Medical Society, to give you an example, the New England Journal of Medicine, premier medical journal in the world, basically was a struggling publication from 1812 was on the verge of bankruptcy in the early 1900s until a Worcester physician who was on the council of the Massachusetts Medical Society passed a resolution that would say that the medical society would buy a subscription for every member. And so they raised the dues by $7 a year. And at that time, the dues were like 10, so
Yeah.
7 is quite a bit. And bought everyone a subscription. And that bailed out the New England Journal of Medicine. And that was Homer Gage, who was on the staff of Memorial Hospital and was also very active in our medical society. That led eventually, about a decade later, to the Mass Medical Society just outright taking over the New England Journal. It still was struggling and paying to keep it going. They did that for an additional 50 years until it turned around. Today it is extraordinarily successful financially, and but in all those days it wasn't. The nucleus for that came from Worcester.
Got any other stories like that you want to share? Or are we stealing your thunder for the video?
Well, I would say that the question of the woman question, which was coming up since Elizabeth Blackwell in New York State got her MD degree, and then later there were.
So what year was that?
That was in the 1850s. And then Boston University, basically their medical school was initially, very early on in its course, was a women's medical college. So there were women who were going into medicine, and they were not admitted to the medical societies. Worcester in 1873 passed a resolution encouraging the Massachusetts Medical Society to admit women. Worcester couldn't admit them, being a district of the society, without the Massachusetts Medical Society doing it. But the issue was discussed in Worcester, a resolution was passed, and it took the Massachusetts Medical Society nearly a decade after that to finally pass it. But nonetheless, that was another bright idea that started here in Worcester.
So have we foreshortened the 10 years learning curve for the Mass Medical Society after Worcester teaches them what to do?
It's, there are a number of innovations that have happened here. I think that we have been leaders with regard to, even more recently with electronic medical records, thinking with regard to group practice and how that incorporates into things. I think there's a lot of innovation that has occurred in Worcester that has set the example, particularly if we think in terms of the Fallon Clinic, which is now the Reliant Medical
Group. HMOs.
One of the first HMOs, but also the group practice that was built essentially on a Mayo model in the 1950s, actually.
Mayo.
The Mayo Clinic.
Mayo
right.
Clinic, right.
Yeah.
It sounded, okay.
Yeah. But in any event, so there's a lot of innovation that occurs in Worcester, but I think importantly is the fact that this society is remarkably successful. It engages the physicians that belong to it. People are active, they're happy to come to meetings. The attendance at meetings is better than most organizations experience. And this is because there are people like you and many others who put energy into it, who essentially, this is a avenue for us to realize the ideals and to achieve more as a group than we could as individuals, and to make ourselves better in many ways than we could working alone. So it's an organization that builds people as individuals, achieves more for medicine as a whole, and I think interacts very constructively with the Massachusetts Medical Society to move that organization forward as well.
One of the things that I cherish in the Worcester District Medical Society is our interaction with our state representatives and senators. We've always had a good relationship with them. And I think because of that, some of the best bills that have come forward, I mean, Dick Moore was instrumental in getting what was called Romney Care, which was actually Dick Moore and our local representatives who worked on this for years, pulling that along, and we did the experiment, and it started here in Worcester, of what's now the Affordable Care Act. Whatever you think of it, it's now law, and it's got a lot of people covered that weren't covered before, and promoting our ideal of universal coverage, whatever that means.
Right.
But again, the Worcester District Medical Society,
right
at the heart of all of this.
Right.
And, have any other juicy bits that you want to share?
Well, I think that, from a point of view of just having an interesting collection of instruments and devices, where we are in the process of doing our inventory and trying to see what we've accumulated over the past 225 years. As far as documents go, we have original documents that are stored both at the Society and at the Worcester Historical Society, so we can actually look at the handwritten minutes from that first meeting in 1794. So as a historian, I just think that that is absolutely terrific. But also with regard to just the things that are of more interest to patients in general, we have some members who are extraordinarily insightful and successful with regard to electronic medical records, and are basically doing a lot to turn around the bright idea that didn't turn out too well of the electronic medical record, and make it successful. So we've got Larry Garber, who's worked with the Reliant Medical Group and has a very successful implementation, and he is very generous in sharing what he's learned with the public and with other organizations. So I think that when we have innovation that occurs here, and I think that we have a spirit that says that this is something that we happily share with others.
So in talking about other aspects of the medical society, about the things that harken back to what you were talking about how working together we do things better. I just brought to mind some of the innovations that we've been able to do with caring for some of our sick physicians, people, say, with addiction problems or alcohol problems. Can you talk to that in terms of the historical aspects about when that all came
Viewing
through?
people as people, physicians as people as well, I think that is something which the Mass Medical Society has done a large amount with. Worcester has been constructive in helping with that. It gets into the notion of issues regarding mental health, which I think are moving more towards the front burner today. There are other issues that Worcester has played a big role in the past. To give you a couple of examples, we had a public health effort back in the 1960s, and this was related to the fact that there was a tremendous need to improve the uptake of measles vaccine. And through an effort with the Massachusetts Medical Society and the Worcester Medical Society, there was a big push to get everybody to have a measles vaccine. And the results were that in 2 years, the number of reported cases of measles in Massachusetts dropped by 98%, which is an absolutely remarkable result. And when one considers the debates that are occurring today with regard to measles vaccine and the like, it's remarkable how successful we were back in the mid-60s.
Well, the success has probably been the nidus for people mistrusting the need for it,
Because there isn't any measles out there.
There's no measles out there.
Could be.
But I still have some patients who are partially blind and partially deaf from their mother having childhood measles or congenital measles.
Right.
They're around. There are people around, and they would say, "Hey, get the shots."
Right. And I think hopefully the pendulum is swinging on that, and the public will return to a more constructive uptake of the vaccines. Another thing that was very insightful at the time and foreshadowed what we were going to see today was a pediatrician in our organization, A. Jane Fitzpatrick, felt that there was a growing problem with narcotic abuse in the late 60s and early 70s. And she started a group that would go to the schools and speak to them about the dangers of narcotic abuse. But also, what I thought was remarkable was we have our own publication, then called the Worcester Medical News. And they had an editorial admonishing physicians and saying every time you write a prescription for a narcotic for your patient, you're setting them up to potentially become an addict. Be very, very careful. And the fact that today we look at those with prescription drug abuse and see an injury or illness in their past that sort of triggered it, it's remarkable that in the early 1970s we had an editorial saying exactly the same
remarkable.
thing. Yeah, yeah.
Really remarkable. And we've had more in the way of public health, having our community immunity adventure with Dr. Morse leading the charge there,
Right.
and we've that goes on. It turns out that it's a place where our medical students learn how to vaccinate.
Right. Well, we've developed this interaction with medical students. The Community Immunity Project, which involves flu vaccine that is given out in the fall in a series of settings that are convenient for the patients and involve a lot of volunteers, some of which are medical students. It's a great way to immerse medical students in the community, and it's also one more way to increase the number of people who are getting their flu vaccine and decrease the burden of that disease each year.
Well, we could probably go on all of the exciting things that have happened over the
Right.
years, and we're going to have a good time celebrating them on September 27th at Mechanics Hall with the Worcester District Medical Society, celebrating our 225th. And it's a pleasure to have our historian and curator, Dr. Dale Magee, as a guest. This has been a wonderful time talking about all of this. And I hope that our discussion has people excited about the Worcester District Medical Society.
Great.
So thank you again. This is Dr. Bruce Karlin, your host for Health Matters, brought to you by WCCA TV and the Worcester District Medical Society.